the Maria Holder Diabetes Center.
Sugary drinks spike your blood sugar faster than anything else. Water is your best friend.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
Wait, what happening on QFM round now? Get ready for some health information as it's time for 15 diabetic friendly minutes on 100.7 QFM, all with the compliments of the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, and the Maria Holder Diabetes Center. Good afternoon, Q people. This is Peter Boyce here. If you are diabetic or pre-diabetic, you are listening at the right time, because you will hear some information that is good for you. And if you aren't diabetic, but you just want to remain healthy, you will learn something too, as all are welcome at the Maria Holder Diabetes Center, located in Warren St. Michael, right behind Eunice Gibson Polyclinic. How are you feeling today, people? If you had lunch not too long ago, right, and you are wondering how healthy was that food that you ate, and how you could improve your diet, and you might be wondering, what can I eat that will not raise my blood pressure or my sugar? Well, at the Maria Holder Diabetes Center, you can find dietitian Victoria Cox there to advise you on what you can eat. And next thing, you remember that once a year, you are to get your eye screened for diabetic retinopathy? You remember that, right? Once you are a diabetic, it is mandatory for you to do that every year. That can be done also at the Maria Holder Diabetes Center. And look at your feet. If you've noticed that your feet have been swelling up recently, you might have venous insufficiency. What's that, Bozy? What Barbadians refer to as bad circulation. A vascular screening to address that can also be done at the Maria Holder Diabetes Center. So get something right on this number. Make that appointment today. Just call 417-0305. You got that? We can give that number again before the end of the show. But right now, who you can also find at the center is diabetes specialist Dr. Diane Braffett. You know Dr. Braffett? Well, she's going to be coming on QFM right now to share some of her medical wisdom with you. And today she's dealing with a hyperglycemic event. Imagine this. You're out with somebody, right? And the body started to have a hyperglycemic event. What do you do? Let's hear Dr. D.
So how do you manage a hypoglycemic event? Well, the first thing that you want to do is you want to have some fast-acting carbohydrate. Stop whatever you're doing and you're going to have some fast-acting carbohydrate. And that can look like 15 to 20 grams of carbohydrate that's going to work pretty quickly, or sugars. And that might be a half a glass of juice. It can be several hard candies. It can be jelly beans. Sometimes that might be 5 or 6 jelly beans. It can be glucose tablets. I know you used to be able to buy those at the pharmacy. I used to buy them when I was small and eat them just because it tastes good. Not that I had diabetes, but the hard glucose tablets. And don't buy them and eat them because you can't eat them. They're meant to be saved for, low blood sugar attacks. Sometimes a small amount of box juice. If you are somebody who's on medication that predisposes to hypos, or you've experienced a hypo and you drive, please make sure that you keep some rescue treatment in your car. I also tell people to keep rescue treatment by their bedside. You don't want to be having a hypo at night and suddenly you got to find your way through the dark while you're feeling fuzzy-headed and confused. Okay? And so you would have that fast treatment, and you'd normally retract the blood sugar in 15 minutes. If the blood sugar is still low, under 4, you repeat the fast-acting carbohydrate and follow it on by some more complex carbohydrates, such as your next meal, if that is due, half a sandwich, maybe 3 biscuits or something of that nature. Okay, so I want all of you out there, especially if you're living with diabetes and you're taking medication that puts you that can increase the risk of hypoglycemia, just to be aware as to how to manage it. However, I do want to mention that nowadays, with the safe use of insulin, meaning that you're using it at the right timing, you're using it at the right dose, the risk of low blood sugars can be a lot lower. Remember, not all of the insulins have that same kind of, I would say, high risk of hypoglycemia or equally high risk, but it depends on the type of insulin. But I think that making sure you're on the right dose is so important. So when you go to your doctor, make sure that you're taking your true blood sugars with you. If you're not taking your medication properly, let your doctor know so that your doctor doesn't go, oh gee, your blood sugar is high. Okay, we need to increase your medication. Whereas in fact, your blood sugars are high because you're not taking the medication. That could actually put you at increased risk. So always be truthful and transparent with your healthcare provider as to what is going on and as to what other things might be going on that might be causing the issue. Okay, so even the cell phone years that we use in Barbados today, they have a much lower hypoglycemia risk than the older ones. But I still want everyone to be aware of this topic because every so often we have persons in our clinic who we meet with hypoglycemia, but also persons who have type 1 diabetes or people who have to use diabetes multiple times a day, type 2s using insulin several times a day, who may be experiencing hypoglycemias or hypoglycemia unawareness. And remember what I said, you need to know the correct timing for the type of insulin you're taking because sometimes it is simply linked to the person taking the insulin at the wrong time relative to their food, etc. My final caution is that if you are experiencing hypoglycemia and it's happening recurrently and you're driving a vehicle or especially a heavy duty vehicle, you should not be driving. You're putting yourself and other persons in a very dangerous predicament. So please be aware of this. In other countries, you would actually not be permitted to drive, as should be the case in Barbados, until you can prove that you've fixed whatever issue is going on. If you are driving a public vehicle or a heavy duty vehicle, you should always actually check your blood sugar before you get in that vehicle, and you should run your blood sugars at 5 and above at least for safety. So thank you very much. However, discuss this topic further with your healthcare provider.
Thank you very much, Dr. Braffet. Wait, there's more? You have something else to add?
Oh yes, I just wanted to add on just a quick fix. If you have somebody who's having a low blood sugar, we always recommend first of all that you check the blood sugar to see how low it is so that the healthcare provider will know if adjustments need to be made to the medication. We know how much adjustment needs to be made. Okay? And also if you have somebody who's poorly responsive, you can use something like honey that you pour into the mouth so the glucose can be absorbed into the gums while you wait on some emergency support. Anybody who's unresponsive with low blood sugar, you should call the ambulance. And that should be your first thing you do, call the ambulance, then try to help fix that low blood sugar. Of course, in severe cases or person with type 1 diabetes, there's something called glucagon that can be used. Not always easy to source in Barbados, unfortunately, but glucagon injections can also be used. But don't forget that honey that you just pour and rub in the mouth and call the emergency services. Always try to avoid low blood sugars in older people because it puts them at a much higher risk of falls and injuries. So just remember, hypos are not your friend. Thank you. Bye-bye.
Save the date! The must-attend event of the season is back in black and white. Join us for a fabulous evening in support of the Barbados Diabetes Foundation, a cause that matters, with a party you wouldn't forget. Jamming for a Cause comes off on Saturday, the 28th of March, 6 p.m. at number 1 Millhouse Complex, St. Michael. You get a welcome drink on arrival, premium food, and live entertainment by top stars. Philip Seven, Nikita, Jeremy Goddard, Chris Clark from 2 Mile Hill, Zukili Ennis on sax, Mikey Mercer, and more. Red carpet vibes, VIP lounges and tables are available, but please contact us ASAP to reserve for your corporate group. This is a critical fundraiser, but also serious fun. Mark your calendars now. You don't want to miss this. A fundraiser in support of the Diabetes Foundation. Jamming for a Cause, Saturday the 28th of March, 6 p.m. Q family, you heard that date, right? That is just next month, Saturday the 28th of March. So make sure you get your tickets as we go into our Q song of the day. And here's one of the artists that will be performing on Jamming for a Cause. This is Nikita with Keep It Up. Compliments the Maria Holder Diabetes Center. Don't forget, 28th of March, Jamming for a Cause.
Rock me soul, rock me baby, make me feel like doing something.
Maria Holder Diabetes Center.
Make my bumper roll it, put pressure on the jumping. So what to do? Grab it by my waist, so tight up on it, so I come bend my back up on my sweetness on it.
Jamming for a Cause comes off on Saturday the 28th of March, 6 p.m.
Get to your better don't flop. I come here to fet this wine non-stop. So no matter man, now it's not time to give up. All I want you to do to me is make me bumper sway. I want you to please me. Keep up baby, keep up. Don't fail me now, don't fail me now. All I want you to do is keep up baby, keep up. Don't fail me now, don't fail me now. Come hard, not soft, no mad. Give me hard jam, when you give me hard jam. Now with the right slam, I give you bam bam. Yes, I need the right man to give the command. Take control, jam it baby. Add some pressure, have it jumping. Don't feel you alone, it's who want me baby. Cause I gon' leave it this now up again. Come what to do? Grab it by my waist, so tight up on it, so I come bend my back up on my sweetness on it. This guy no wine gonna cause conflict. Me don't wanna back and I'll let you down up on it.
Diabetes Center.
Better don't flop. I come here to fet is wine non-stop. So don't back down man, now it's not time to give up.
Another service which is available at the Maria Holder Diabetes Center is vascular or ABI screening.
Who should get the screening, boy?
Persons living with diabetes, persons who experience pain while they are resting, or a burning pain sensation in their legs or toes. If you have what is called bad circulation, if that sounds like you might need this vascular or ABI screening test. Let's hear what vascular spokesman Donald Clark had to say.
I should indicate that this is not a male-only condition because of erectile dysfunction, but female condition as well. Ladies with varicose veins has their condition to have this ailment. So I would want to say that women should also have this test done. Again, peripheral artery and peripheral vascular, which is different because arteries are arteries and veins are veins. But varicose veins is a telltale sign that there's a problem with peripheral vascular disease. In men, of course, it's erectile dysfunction. That is major. That's how you tell that there's a problem. That's how men would normally tell that there's something going on. There's no blood flow, or there's, I should say, reduced blood flow to the penis, of course. But in women, varicose veins is a telltale sign that there's also a problem. Peripheral artery disease, it's a simple test. It's called an ABI test, and I can't stress enough the importance of getting this test done.
If you are diabetic or pre-diabetic and listening to QFM right now, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.